Okay, for our eyeball here, you have your superior rectus, your inferior rectus on the bottom. You can identify the medial rectus by finding your superior oblique, and it points medial, so off to the side here. Our lateral rectus is going to be on this side, and then our inferior oblique is going to be along the bottom here. Alright, so now we're starting into the special senses. So this is going to be our vision, our hearing coordination, and our taste. Okay, so looking here at the eye, okay, so we already went over your individual muscle groups on there, so make sure you review that from the muscle chapter. We can see the white part of the eye, so you have 3 layers on the eye itself. The sclera is the white part. The second layer is this darker part here, so this is our vascular layer called the choroid layer. And again, we remove that. And on the inside, you have your retina. So that's the lighter layer there that's got all the nerve tissue associated with it. So coming from the back of the eye is your optic nerve coming in there. Okay, so I'm going to remove a few things. We'll come back to those. And we can see the optic disc right here. That's where the optic nerve is coming into the retina. Okay. You can also see, so if this is the optic disc, just adjacent to it, there's, in this model, it's kind of a pink dot, but it's another region called the macula lutea. And right in the middle of it, so in the middle of the macula lutea, is the fova centralis. Okay. So filling that region, okay, so everything from this point back is our posterior cavity, and this big clear structure here is representing the vitreous body, which is kind of a gooey substance back in there in a real eye. Okay, so that's our posterior cavity. In the anterior cavity, we start with our lens. So the lens sits kind of in a cavity within that vitreous body and sits behind the pupil being the hole in the iris. The iris is the colored part of the eye. All of that sits behind the cornea. The cornea is the clear layer that surrounds the eye itself. We take all that apart. Now we want to look on the inside here. Okay. So we have a ciliary body. So that's all of this structure you're seeing here. The ciliary muscle is this, in this particular model, it's kind of the smoother outer layer here, but it is a muscle itself which connects to suspensory ligaments, and these ligaments are going to constrict or contract the pupil. And that makes up the anterior cavity.